All right, looks like I'm live. What is going on, everybody? This is Dr. Sam Watkins here. Welcome to the Physio Coaching ACL Community. This platform was created by the Movement, Rehab, and Performance team to educate, empower, and improve the outcome of ACLers. Today, we're going to be diving into range of motion in the early stage. And this is something that we get questions about pretty regularly. I mean, range of motion is going to be a big part of the program, of your ACL rehab program throughout the entire process, but it's a big emphasis, especially in those early stages. And so we're going to be diving into what range of motion exercises should look like early on, what things should look like down the line, how you can get your best range of motion in those early stages, so you can really set yourself up for success. There's a lot of questions about this because people all progress at different rates. People are getting all sorts of different exercises from their PTs. And so I want to make sure you have a little more of the thought process behind why we're doing what we're doing, why you should or shouldn't do certain things in certain portions of the early stage. So that's going to be the general topic here. I hope y'all are interested in learning more about range of motion. And if you're not tuning in live, this is going to be, if you can't stick around for the entire live stream, this will be posted on the free section of the page for you to watch at your leisure. So, like I said, range of motion is going to be huge early on, and really it's about setting yourself up for success in the long term, right? We need to get range of motion back early so that we can actually progress to some of the higher level strengthening and power focused things that are required to get you back to sport, right? And so in the early stages, strength takes a little bit of a back seat to range of motion work. And it feels really tedious and monotonous, but part of the reason why we focus so much on range of motion is because we can't tolerate too much of the strength work anyways, right? We can tolerate more range of motion work, but if we try to really load up the knee too much early on and build strength, we're going to flare things up, it's going to get aggravated, and we're not going to be able to see much progress. So we focus more on range of motion, and at around that 2-month mark or so, depending on how you're progressing, the emphasis will start to switch. We'll switch more from focusing on range of motion with a little bit of emphasis on strength and getting the quad going to more of the strength focus. And as we get further and further down the line, it becomes much more strength focused, much less emphasis on range of motion. Maybe you'll just be doing a little bit to make sure you maintain if you're just a stiffer person. But by the time you have full range of motion, 3+ months out, hopefully, it's just kind of doing a little bit of some range work for a warm up and focusing more on building up strength. So, but before we get into some other details, I want to just make sure things are clear here. So terminology that we're going to be using, range of motion, what exactly is range of motion? It's the degree to which your joint can move. And your knee joint has 2 movements that we move through and measure. There's some rotation, but there really are 2 movements. Your range of motion consists of extension. So if I say extension throughout this live stream, I'm talking about straightening of the knee, and then flexion, which is bending of the knee, right? Think about it like the elbow, right? We've got flexion, bending, straightening is extension. Getting this range of motion back as soon as possible is huge to set yourself up for success in the long term, especially the straightening. Straightening is more important in the short term, and if you can't fully straighten your knee, you're walking again, you're back to, going back to school, you're back to work, you're walking around just doing daily stuff without your crutches. If you don't have full extension, you're setting yourself up for a sore knee, right? So imagine walking in a crouch all day long. I think you can imagine that your knees will be feeling pretty stiff by the end of the day. And before we jump into anything else here, I just want to make it clear that this is not medical advice. This is for education purposes. This is not for you to take and apply it to your specific situation, because this is going to be a bit too general to apply to everybody. Right? Your surgeon might have certain range of motion restrictions, right? If you have a meniscus tear, they're definitely going to be limiting range of motion early on. Some surgeons are pretty restrictive early on about limiting flexion to 90 degrees for the first 6 weeks or even beyond, just to be very conservative and safe. And it's super important that you follow those precautions. And I don't know everybody's specific precautions. And so you need to make sure that you're following those precautions. And these guidelines I'm giving are more just kind of general thought processes and not specifics to your case, because I don't know what was done in your surgery, and your surgeon has a reason why they are providing certain precautions. So before following any of these recommendations, check with your surgeon, check with your PT, make sure it fits with what procedures that you had done, and make sure you're not setting yourself up for a flare-up or worse. So again, not medical advice, just for your education to learn more about how you can improve your range of motion and some of the thought processes behind certain exercises. All right, so early range of motion. What are we trying to do? A lot of talk so far about setting yourself up for success, but the reality really is also, with surgery, there is going to be muscular and joint-related damage, right? They had to go into the knee, they had to drill holes, they had to plug holes, and with that, there will be some scarring that builds up. Just like if you were to skin your knee, if you skin your knee deep enough, it's going to scar over. And if you skin your knee and decided to not let it bend ever, you're just afraid of opening that scab up for months, you keep your leg straight, that tissue on your knee would be accustomed to being in a straightened position, and it's going to take some work to get it to bend. And the same thing is happening inside the joint. I like to give that skin knee example because it's easier to visualize than what all is going on in the joint. But that is the general process there. And we want to really get the knee moving early, like day one, so that we're not fighting these tissues that have already settled and are stiff. So I'll see people that maybe, had a really busy work life and they wait a month to come in for PT, even though their doctor recommended that they come in at 2 weeks. And they've only been given a handout for very early range of motion work where they're supposed to do some bending and straightening. And maybe they weren't as on top of that as they should have been. They weren't sure how hard to push. They were nervous about stressing things out too much. And they come in and that knee is just super stiff, right? They're only getting to maybe 60 knee flexion, so bending, when I like to try to make sure that people on day one when they see me can get to 90. And in those situations, that is happening because they were not bending it early enough, and some of those tissues have already settled. It's not too late by that point to loosen things up, but the earlier we can get things moving, the better off we're going to be getting that range of motion back. So how do we do this best? Starting early, huge. Start day one, follow those instructions from your surgeon, start working with your PT as soon as you've been recommended to. Make sure that you're getting scheduled out with your PT before you have your surgery for when you're supposed to start, just so you can get started with guidance as soon as possible. So that's the big thing, start moving early. The next point is we need to work within the pain limitations of the joint. So every time, whether you have surgery or not, every time you bend or straighten your knee, it is a stress. And after surgery, your knee is going to be much more sensitive than your knee if you didn't have surgery, which is obvious, right? But that stress on your knee that you get when you bend it when you don't have surgery is such a minimal stress compared to what that joint can handle that you don't notice it. But after surgery, bending and straightening recently damaged tissues is enough of a stimulus to cause irritation, right? And so pushing too hard in the early stages will increase irritation and inflammation. And if we push too hard and we irritate things, you increase swelling. Let's say you decide like, all right, I missed my morning range of motion session. I'm just going to push this afternoon one super hard. And you push into a ton of pain. You're really sore and stiff for the next week. Oftentimes we'll see that range of motion won't increase and it may actually backtrack. If we push these stress tissues too far and too hard without listening to the feedback of our body, we are going to only promote more irritation, which means we then can't continue to push those tissues to loosen up more and more. So the main 2 points, like I said, are starting early, working within pain. There's going to be some pain, especially if this is week 2, week 3, week 4, working into straightening and bending, but we need to toe that line between pain that's tolerable and pain that's going to cause prolonged irritation. So because we're following what your body can handle and what those tissues can handle by listening to the pain response, exactly what you do is going to vary depending on how early on you are in the process. So early on, like week 2 through week 4, we're probably not doing long holds, right? You're going to get into your end range of motion and you're going to work into it for a second, find that kind of pain threshold, and then work out of it. And that is the best way, I think, early on to make sure that we're not overdoing it. We're not just pushing into these tissues beyond what they're ready for. That's my recommendation early on. We'll talk about maybe later in the early stage, which is, maybe months 2 through 4, somewhere around there, where we're going to be doing more holds. But early on, more like work into it, work out of it, hold for a few seconds as you can. But early on, we're also going to be trying to choose positions that don't lengthen the muscles. And what I mean by that is the muscles around the knee, mostly talking about the quads, so the muscle at the front of your thighs, and the hamstrings, the muscles on your back of the thighs. If we're trying to work in range of motions for the knee, where these muscles are in a lengthened position, there's going to be increased stress getting into these range of motions. And so if you think about like a classic quad stretch, right? Think about if you're standing up and you hold onto your foot and try to stretch out those muscles on the front of your leg. That is a position where those quads are lengthened. And early on, sometimes people will be given a knee bending stretch on their stomach, where maybe the PT is pushing into bending for you in that position on your stomach. I really do not like this exercise for people early on in their rehab process, because we are not actually able to lengthen the tissues at the joint level, because that extra length from the quad puts too much stress on the knee, right? So we want to try to get in positions where the quad is shortened so that we are able to actually lengthen the tissues at the knee joint. So maybe with just some numbers for an example here. Let's say if I measure someone's bending range of motion with them laying on their back, passively I push them into a knee bend, see as far as they can tolerate. I measure there, and let's say they can get to 110 degrees. If I was to take them on their stomach and get that same measurement, they would maybe, if they're early on, they might be limited to 90. And so, yeah, we are getting into a bend position, but we're not getting to that same range of motion, that 120 degrees that they can actually get, that's more limited by knee tissues, because the extra length in that position on their stomach at the quad puts more stress at the joint, and they're not able to handle as much of that. I'm not worried about lengthening muscles at this point. I want to make sure that the tissues that have been damaged with surgery and that are going to scar over are getting lengthened. The quad length will come back. So positions are important here, right? For bending, we want to make sure you're not in a position maybe on your stomach where that quad lengthened. For straightening, we want to make sure that you're not in a position where your hamstring is super stretched, right? So maybe if you're fully elevated, legs up in a hamstring stretch, you're not going to be able to get as much straightening because that extra tension from the hamstrings is putting too much stress on the joint. I don't see that as much of an issue, honestly, as the quad stretch. But if you're week 2, super early on from your surgery, you might not want to be stretching your knee into extension in a position where your foot is really elevated, where your hamstrings, those muscles on the back of your thighs, are also lengthened. So early on, we want to maybe limit the amount of long holds that we're doing, and then also choose positions where those muscles aren't lengthened. And if you're having trouble with your range of motion early on, and you're focusing on range of motion, bending range of motion, for example, on your stomach, honestly, I think that could be a big reason why it's so difficult for you. Now, later on in the early stage, maybe month 2 to month 3, even up to month 4, we might not have full range of motion, but the knee is able to handle much more, right? By month 2 and 3, you should feel like, oh yeah, I can walk around, I can do my daily life. I'm already doing some, low impact strengthening exercises, things that your knee couldn't tolerate at week 2, week 3, right? And that's just part of the healing process. So your knee can handle more, and those tissues at the knee that are undergoing repair are going to take a little bit more load to lengthen because they've settled in a little bit more. Combination of because they've settled in more, and also we're getting into deeper ranges. So it's just going to take a little bit more force to lengthen those tissues, right? If you think about maybe trying to learn to do the splits, for example, right? Maybe you can get the first 75% of the splits pretty easily. A week or 2 of some work, being consistent, you'd be able to lengthen those tissues and get into a decently deep split. But that last 25% of that split takes way more work than getting that first 75% of the split, because the more that we need to lengthen tissues beyond their true length and max capacity, the more effort it takes. And the same thing is the case here with your ACL rehab. So let's say your natural knee bend, you're at 130 degrees, and based on your other side, we know that you can naturally get to 150. So you have 20 more degrees to get. You've already gone from 60 degrees of range of motion to 130 degrees from over a couple week period. And now you're almost a month and a half out, and it's like, all right, we got to get these last 20 degrees. Probably will still take another month or so to get that last bit, but we're going to need to be able to apply more force to these tissues to actually get that last 20 degrees. And it's good news because the knee can handle more, so we can actually provide more of these higher intensity stretches to actually lengthen the tissues, right? So later on, months 1 or 2 and 3, to get that in the deeper ranges of motion, we are going to be doing more prolonged holds. So less of like the gentle in and out, more of like 10, 15, 20-minute holds into deep ranges of motion. So what exactly would this look like? If we break it down into more of the early stage and like the late early stage. So early stage is more of like weeks 2 through 4 to 8. The later early stage, more like weeks 6 to 12, right? So early stage. So first month or so, like I mentioned, choosing positions that don't lengthen muscles as well, and not doing prolonged holds within pain and keeping it within pain tolerance. So week 2, week 3, your range of motion might look like doing quad sets, just flexing your quad in a straightened position, laying on your back, right? You've got gravity pushing down a little bit. You're trying to squeeze your quad to straighten that leg. And I oftentimes will tell people, you're going to do 100 reps a day. Sounds like a lot, but if you break it down into 3 10-minute periods where you're focusing on getting that quad straightened, letting gravity push down, letting your quad push into extension range of motion, not pushing it beyond what your knee can tolerate, that's a good way to work on things early on rather than, reaming on that knee, this already sensitive knee, to push it into extension when it's just not quite ready for it. So that's for extension. For flexion, for bending, I'll oftentimes have people put their feet up on a ball. Oftentimes people use kind of like the big exercise balls at home, and they just sit in their garage and they're like, yes, please give me something to do with that, because it's been sitting there for years. It was an aspirational purchase. All right, let's get some use out of that. And so what I'll have people do with this is they put their feet up on the ball, laying on their back, and then they do most of the pulling with their non-surgical leg to pull back into a bend, pull back into a decent stretch, slight amount of pain, hold for a couple seconds, come out of that. That would be maybe 3 to 5 minutes a day. So not 3 to 5 minutes a few times a day, sorry. Because we got to give some regular input. And like I said, sounds like a lot, right? If you're doing 100 quad sets a day, a couple rounds of 20, and then 3 rounds of 5 minutes of the knee bending, it takes some time and it takes some effort, but it needs to be done early on. And it feels like a lot, but these positions should hopefully feel like ones where you're not feeling like it's torture, right? Because the knee isn't lengthened and we're respecting that pain response. Now, if we get into that kind of later stage of the early phase, still focusing on range of motion, we're going to be getting into more of those prolonged hangs and positions where we're trying to lengthen those tissues over a longer period of time, right? And so these would maybe look like, for straightening, a knee extension hang. So this could be sitting on your couch with your foot on a coffee table, with your leg floating and unsupported, right? So you have your heel on the table, you're seated on the couch, your knee doesn't have anything under it, and gravity is just pushing down. If you're limited in extension, I might have you do 3 rounds of 15 minutes. And by the end, you should feel like, yeah, I'm ready to be done. Like, I don't want to go any longer here. And that tells me that we're still listening to that pain response, but we have reached the extent of what those tissues can handle and have lengthened them as much as we can without overdoing it. So if extension is more of an issue, three rounds of 15 minutes a day. If you already have mostly full extension, it might be a couple rounds of 5 minutes, just hanging out with your leg unsupported. Working on knee flexion, kind of a similar idea. One I really like is if you're laying on your back with your hips up right up to a wall, you get your foot up on the wall, let your knee slide down or let your heel slide down the wall until your knee's at a deep enough bend where you're feeling like it's a pretty solid stretch. Same idea. If knee flexion is something that you're still struggling to really get, a couple of rounds of 15-minute holds. And you can kind of work in and out of it a little bit. You might find after a few minutes that same degree of knee bend isn't quite as sensitive anymore. You can go a little deeper. But same idea, by the end of that 15 minutes, if we really are trying to increase that range of motion, lengthen those tissues, you should feel like, oh yeah, I'm ready to be done. And by doing that, we've reached the threshold of what those tissues can handle. We've lengthened them as much as we can without overdoing it. And realistically, with both of these hangs, you're going to finish up and feel like, yeah, I'm a little sore. I got to walk it off for a couple minutes, but you should feel like after 20 minutes, an hour, like, oh yeah, my knee's back to normal. But if you are finding that these holds make you sore for the whole rest of the day, to where you can't go as deep with the second round or third round of the day, it means you're pushing too hard. And we just got to scale it back a little bit. Even later on, we need to make sure we're staying within that tolerable level of discomfort. So those are just some examples there, but the amount that you push into things, the amount that you are going to hold versus move in and out of ranges is going to vary depending on where you are in this entire process. Yeah, getting range of motion back can be tough, right? Usually people have one direction that feels like it comes back much easier than the other. Some people will find that getting flexion back, the bending, is a piece of cake, and extension, like they've got to work for every degree. But it could be the opposite as well. Some people find extension much easier, and just flexion is a grind throughout the entire process. and that's just our natural anatomy. Oftentimes one is harder than the other. It's not usually the case that they both just come back without much of a fight. So you're gonna have to work at it, one more than the other, and your program should reflect what you need, right? It's not a cookie cutter approach where you just are doing both flexion and extension exercises equally. If you already are getting full extension back, but your flexion's still lagging behind, I'm probably not going to have you do 15-minute knee extension hangs if you're just readily popping back into full extension. But we will probably be doing more deep flexion holds, and vice versa if extension's harder than flexion for you. So things tend to slow down a little bit after a month or two, and we're not getting 10 degrees of improvement every week, and that's just how it goes. But oftentimes people will wonder, when is something going wrong here? Like, why am I slowing down? Why is my progress slowing? Part of that is the reality, but there are a few things we want to look out for that might require more intervention from a medical standpoint, like checking in with your surgeon to make sure that there's nothing going on. And the two things that are most common are called arthrofibrosis and a cyclops lesion. So arthrofibrosis is excessive scar buildup at the knee joint capsule. So around the knee, we've got the femur, we've got the tibia, we've got all the ligaments that connect on the inside and on the outside of the joints. And we also have other tissues that kind of encapsulate the knee joint. And some people are just naturally going to build up more scar tissue. And if you're one of those people, one of those lucky people, you will potentially find that after a month or two, your range of motion, particularly bending with arthrofibrosis, is suddenly, it's just not budging. It's just like you can ream on it all day, you do your range of motion work, and it's just not coming along. And that can be a sign of arthrofibrosis. And so if you get to a point a couple months out where you're at 120, 130, and you're just finding like, oh man, this thing is not bending anymore for a couple weeks, and you've really been diligent about pushing into that range of motion, that it might be a case of arthrofibrosis where that scar tissue has already, you've maybe built up excessive scar tissue already, and that tissue has just kind of settled already and isn't going to increase much without some medical intervention. And sometimes things like steroids, whether that's oral steroids or an injection that your surgeon can provide you with, can provide a nice anti-inflammatory response to settle down those tissues and allow them to extend again. But in some cases, a procedure is required to loosen those tissues up. So it's not super common, but if you're getting stuck at 120, 130 or less and feeling like, I'm doing all the things, why isn't it bending more? If after a couple of weeks it's not changing, it's time to get that checked in on, so you can actually continue to see progress. Now, if you're at 140 and you are only trying to get to 145 because that's what your other knee gets, that might be normal. It might take longer just to lengthen those tissues. That probably is arthrofibrosis. But if you're stuck at lower degrees of bend, that's probably the case. And arthrofibrosis is almost always with more of a flexion limitation versus extension. On the flip side, a cyclops lesion would limit extension. So with a cyclops lesion, we end up getting actual scar tissue buildup around the ACL. And it can pop up kind of throughout the entire process, but usually is in this first few months, and we'll find that all of a sudden extension is just stuck. Like, you can't get your leg straight anymore. It could be other things, but same idea. If a couple months down the line you're finding like, oh wow, all of a sudden my extension is lacking much more than it was before, then there's a chance that that's a cyclops lesion, especially if it's not super painful. If it's like, no, I just get stuck there and it doesn't hurt anymore, that needs to be checked out as well. So that's something that the surgeon might need to check out, and could be another surgery to just clear out that scar tissue so you can actually lengthen lengthen that new ACL and get full extension again. So those are the two most common issues we see with range of motion that actually require intervention. Otherwise, it's just kind of grind. It's going to feel hard. You're going to feel like it's taking up huge chunks of your day. And that's the unfortunate reality of ACL rehab, is you got to put the work in to see the result that you want. And if you don't, it's going to be a longer process, because if we can't get the full range of motion, your knee is not going to be happy, and we're not going to actually be able to target strength, power, athletic movement. That takes time to build. So focus on it early on. One other little point here I want to make is about getting hyperextension. So early on, some surgeons are going to be pretty conservative about hyperextension and say, I want to keep it at 0 for a little while, even if your other knee has some hyperextension. And you got to follow your surgeon's recommendations in that regard. But in the long run, we do want to try to normalize hyperextension. There used to be, in maybe like the early 2000s up until 2010 or so, a thought process that we don't want to lengthen these tissues hyperextension because we have this new graft, we got this new ACL. Let's keep it nice and taut, keep it nice and firm so that there's less chance of tearing. But what we have seen with some new studies is that knees are much less happy and much more irritable when they don't have their full extension range of motion. So if you have 5 degrees of hyperextension on your non-surgical knee, we want to try to get 5 degrees back. And we might not be pushing that month 1, maybe not month 2, but month 3, month 4, we want to make sure we're really starting to see a positive trend towards that full hyperextension. So it's not something to be scared of. I think the term hyperextension has a little bit of like a bad connotation, but it's something we want to get back. That's just what your body is made to do. And if we don't have the ability to access that because it's stiff, your knee is more likely to be aggravated. So that was just one point I wanted to make there. But in summary, getting range of motion back is crucial. Super important. It sets you up for success in the long term. We want to start early, right? Day 1, day 2, follow those instructions from your surgeon. Don't push into crazy pain. Listen to the pain tolerance. And that's especially important early on, but is still important even later in the process as well, right? You shouldn't feel like you work on your range of motion and your knee is super sore for the rest of the day. If you are, you're actually probably not getting as much out of your range of motion work and are making it a much more uncomfortable process than it needs to be, so you can see a better outcome with less torture, right? Because let's be real, if you're cranking on your knee into bending and making it hurt super bad, it's not going to feel great when you're not seeing as much range of motion gain as you could if you were going and making it much more comfortable for yourself. So start early, work within your pain tolerance. We've talked about how we can modify your range of motion program so that you can work within the pain tolerance early on versus a little later on. But then the last point is you got to stay consistent. You got to be consistent early on, and you got to stay consistent throughout the process. And I know it's going to feel like a lot, but the good news is if you can put the now and early on, it's something that it's temporary, right? Once you get your full range of motion back, it'll be a minute a day, 2 minutes a day. Just keeping that is so much easier than gaining it. And if you don't put the work in and aren't consistent early on, you're going to be fighting it for months and months and months. And it's going to slow down the entire process. So work with your PT, start early, stay within your pain tolerance, and be consistent, and you'll get there. Very few people have any of these other arthrofibrosis or cyclops lesions, but the more that you can keep things moving and push it to these right challenge levels, the more likely you are to have success. So that's all I wanted to get into with range of motion. Hopefully this has been helpful for y'all. If you have questions, feel free to pop them on the feed. We can answer things there. And if you have more personalized questions in the paid section, we have Q&A live streams. We have Q&A time at the end of all of our live streams as well. So if you have things that you want answered, come find us on there. Click the link to schedule a consult. We're here to help. Again, the whole purpose of this ACL community is to help you get the answers that you want, right? Getting answers from the experts rather than asking questions on Facebook groups to other patients that have had totally different experiences, right? And the reality is they might be working with a PT that doesn't have great experience working with ACLs, and they're just regurgitating what they've heard from a random YouTube video or from their PT who's maybe didn't do a good job with them. So we want to make sure that you have the power to make the right decisions, to really just have a good outcome, right? We want to make sure that you can get back to the things that you love doing. And I know ACL rehab is hard and there's tons of questions. So come find us on the community and we'll help you out. All right, guys, it's been good talking about early stage range of motion. Pop on the feed and shoot us over any questions you have. Talk to you guys later.